Good afternoon. We're really excited that you've decided to tune in today. We are here to discuss International Overdose Awareness Day. This is a very important topic for us here in our community. We have Chief Love with the Alabaster Fire Department and Kristie Pettway-Latham with the State Opioid Response for Alehia's House. Our two experts are going to share some information about what we're seeing here in our community, as well as share some tips for our parents to help us reduce the amount of overdoses that we see here in the city of Alabaster. So, Chief Love, I know that our city has been impacted pretty greatly over the past several years with what we've seen with the opioid epidemic and opioid overdoses in our community. Can you speak to some of our statistics for the community so people can understand what we've seen?
Sure. We now have capabilities since January of 2018 to actually track and break down the data a little better in different instances of any type of EMS call. Previously, it would be a little bit skewed, so now we're able to break that down. So in the last 18 months, starting in January 2018, I had our IT personnel to pull up some of the data. So we've actually administered Narcan to patients 61 times. So that means that patient was depleted enough to the point where they had to have the administration of Narcan to help them survive. We're now able to break that down a little further when we have facts based from the scene, so we can see the drugs that they're actually affecting. So we know that heroin's involved in 5 of those instances. We know that different opiums are involved in many of those instances, and we even are able to break that down where it shows in those instances 5 of those were cardiac arrests, not to say what the outcome is. So you look at a city of 33,000 individuals basically, and we've had known 61 instances of overdose, and those numbers that are associated with opioid use, whether it's abuse, accidental, still our numbers are climbing. So we'll be able to monitor that a little bit better now. We can even break it down, and it kind of goes with statistics a lot of times because we see the usage based on months, and in that time frame during the month of December, that was our peak spike time, so which goes along with some other issues you face with people with suicide and things of that nature. So that tells us that even though we think in our city things are quiet, we're still seeing a spike in the usage of it and the effects and how it affects people in a negative way.
Kristie, when we talk about overdose, whether it is an accidental overdose or an intentional overdose, we work a lot with parents, and we want to educate and empower our parents to help their young people. So are there things that parents can do maybe within their home to make the homes more safe and secure for their youth?
Absolutely. The biggest thing is being aware of what your children are doing. If you are prescribed a medication, make sure that it's concealed for you. Make sure that it's only for your consumption. Children tend to experiment, children tend to wonder. So just being accountable for where your medication is held, making sure that it's in a safe and secure location.
Chief Love, what is the best way? So we all have medications in our home. We get prescriptions. We may or may not use all of them. Some medications are more dangerous than other ones. What can we do here in the city when we have medications that we need to get rid of? What is the best way to do that?
Well, there's multiple drop points for them at our police station, and we've even engaged where we may increase the number of drop points there. People need to keep in mind when they're prescribed a medication, especially a pain medication, is for a certain instance. That's not some of those medicines you want to keep, let them linger around. When you're finished, your illness is corrected, get rid of that medication. Because children have that opportunity to maybe do a little investigation, and it doesn't take just one time where they really didn't have an intention for it to be a bad situation. It turns into that. So a little vigilance on the part of adults, a little awareness that whether you like to admit it or not, you may have family members that are having a problem with this. So the easier it is available to them, the easier that they're going to try to reach out. Even during the time when you're under that treatment, keep a constant count on what you're doing. Keep it stored in a place maybe where only you know it, where it's located. Be vigilant about protecting those medications.
One thing that we do know is that 2/3 of young people, so these are our teenagers, access medications from the home. It could be their home, or it can be the home of a family member or friend. So that is absolutely, access is a huge issue when it comes to the misuse of medications. Kristie, so we're here to discuss the International Overdose Awareness Day. And we do focus a lot on opioids and the opioid epidemic here in our community. But one thing that we do know when it comes to our young people is alcohol. That is our #1 used substance with our youth. And that is specific to here in Alabaster, but we see that in a lot of our communities too. When you talk about alcohol with parents, do you give them tips on how to prevent the abuse of alcohol with their young people?
Well, a lot of times the parents are the way that the children are getting the alcohol. So just to be the advocate to say it's not okay. It's not okay to supply your 14-year-old or 15-year-old with alcohol. It's not okay. Their minds aren't fully developed, and the consumption of alcohol not only destroys their body, but their minds as well. So being able to be the adult which you are supposed to be, and just let them know when you're of age, of 21, that's when you can consume alcohol. Children tend to start or experiment around 14, 15 years old, and it's not okay. So letting parents know that it's okay to be a friend, but not a friend that supplies alcohol. Absolutely not.
Absolutely. Chief, I want us to talk about overdoses themselves. So I know that you all do respond to those through the fire department. Let's say we have somebody who's in a situation where they suspect that someone is overdosing, whether it's on medications, it could be alcohol, other types of illegal substances. What do they need to do?
The first thing people need to remember is if they suspect that and there's an illness, the person's consciousness is lower, first step's call 911. And then there's TV and things kind of lead you to believe things in a wrong direction. You see many times people slapping people, things of that nature. It's absolutely the wrong thing to do. You want to try to wake them up, maybe a sternum rub. It's just to verify that they have reached that point. Airway protection is one of the things that we're concerned with. We use Narcan for opioids, but there's other drugs that Narcan won't have any effect on, so the patient's condition can deplete really rapidly. You don't want to leave them. Prepare them, roll them to their side in case they were to vomit, so that we don't block the airway. Because a number of in overdoses that we see is just the simple reason that people go into cardiac arrest is from a blocked airway, as simple as they're slumped over and the airway gets blocked, and this is associated with alcohol, severe alcohol poisoning, whether it's narcotics or whether it's any other drug. People that vomit then aspirate and their airway gets blocked. So those are important points. Call for help quick, because you're going to need that help. They're going to need some rapid transport to the hospital. They're going to need the treatment of EMTs and paramedics on scene. According to the situation, we may or may not have the opportunity to reverse the effects of the drug that's on board, and most certainly we can protect that airway. So you want to keep that in mind. And awareness to the people that you deal with. Today's overdose is not what was considered 30 or 40 years ago. It affects all demographics. It affects all age groups. They can't be too young, they can't be too old. Their socioeconomic status really has nothing to do with that anymore. What people tend to picture that is not the case. So, kind of like, don't be the ostrich, don't put your head in the sand. Realize that this could be happening to you or your family member.
Let's say that I'm a young person and I'm at a party, and I think maybe my friend has alcohol poisoning and is overdosing. If I call 911, will I get in trouble?
No, you won't get in trouble. And from an EMS response side, we're there to treat the patient. Although in Alabaster, our police department pretty much goes everywhere that we go. And as Kristie mentioned earlier, underage drinking is illegal, and it's just wrong. So our primary concern is treatment of the patient and making sure that they're safe and secure and we get proper treatment for them. But if there's other issues going on that people are participating in that are this illegal activity, by all means, that would have to be represented by law enforcement.
Kristie, any tips for parents, anything that you can?
Know what your kids are looking at, know their friends, monitor their behaviors. When their behaviors start to change, ask questions. It's okay to ask questions. And hopefully you get answers, but it is okay to ask questions. Let them know that you see them. Let them know that you are managing or you're aware of what's going on with them. So just being able to, like you said, be vigilant in their life, be there in their life, be present in their life and their behavior. If their grades are dropping, you should know why. Ask questions.
Awesome. One thing that I have found has been a really positive parent tip that a lot of our parents and teenagers appreciate is to set up a code word with your young person. So let's say, especially in middle school, if you've got a middle schooler who goes to a party at a friend's house, they don't have a car there. They're depending on somebody to pick them up and take them back home. And they may get there and there's things going on that they're not comfortable with. You know, whether it be alcohol has been provided or maybe there's other drugs there. But to work out ahead of time for your teen to be able to text you just a word so that you know you need to come and get them.
Absolutely.
That has always been that's a very strong prevention tip for families. And I think your kid needs to know if they feel unsafe that you'll come and get them, that's just something you discuss and you've worked out.
And that promotes healthy conversation. So with you all having that conversation, you're letting them know that if you're uncomfortable, I'll come get you. Not drinking at an early age, I'm not okay with that, and if you're in an uncomfortable situation, I'm here for you. So I think that promotes healthy conversation.
Absolutely, that's awesome. One thing that we do know is parents are the #1 influence in their teen's life. I know sometimes when you have a high schooler, you may not feel that way, but we do know that they're listening. And so sharing those tips and having the healthy conversations can really impact and influence the decisions that they make. And that's important to keep those going. That's awesome. Chief, you touched on briefly and wanted to talk about a little bit more, because we are in the midst of an opioid epidemic, and while we are seeing some positive changes nationwide in the statistics, what you've shared, we know we still have a problem here in our community. So let's say that an adult or a young person goes to the doctor. Maybe they need surgery. Wisdom teeth for our young people is usually a source of opioid medications. Any type of surgery can lead to prescriptions for opioid medications. But are there things that me as a patient or as a parent with my young person, are there questions we should ask our doctors before we just take a prescription for a pain medication?
Being vigilant, ask, is this an addictive form of drug? Is this the only drug is available? Is there some alternative? Is there an over-the-counter instead of getting an opioid or something that's an extreme pain reliever? Is there some way that we can look out for ourselves and there are people that are predisposed that they have addictive habits. Be smart about it before you touch it, and look for other alternatives to help deal with that. If you've got a child, think about this. A 12 to 16-year-old child can't make good decisions. They're smart people, you trust them, but still, they're not fully developed and they don't make the best of decisions. So you got a child that's had a procedure and they've got to have medicine. You as the parents got to be responsible. You control the medication. You determine when it's needed, making sure that you keep a good accountability of what's going on in your child, what's going on with that medication. We see throughout time, you see a number of overdoses that are truly accidental. People have had procedures, one-day surgery, they came home, because each individual's body may react different to the amount of drug they give them. Even though doctors do their best estimates on what they need, people react differently and they accidentally overdose. So, and when you're dealing with your own child, accountability is one of the best things. Making sure you are in charge of what goes on with them. With yourself, the same way. Hold yourself accountable. Can I stand this? Is there an alternative? Don't become dependent upon that. It's unfortunate. It's so easy now for people to get prescribed pain medications because it's what doctors, physicians, medical field, they want you to be comfortable with the procedure you had, so that makes it easier. But it is also easy to develop into that addictive state, so be vigilant about that.
One thing that we usually promote with our education through the For Tomorrow team is secure, monitor, and dispose. So if you have any medication, you secure it, whether it's in a locked box or a locked cabinet, you monitor it. That's especially important with the pain medications, making sure you've got the right count for where you should be. And then, as we've already touched on, is to dispose of it properly at one of our drop box locations at the police department.
Yep.
So that's very important.
You know, we as EMS professionals, we administer many painkilling drugs. We carry, and we have a very strict process that we follow, and we're licensed to administer these. All of our drugs stay behind a dual lock system. The key pass on, who controls the key, is signed off every morning, so we know where access to that product is 24 hours a day. We know immediately if that product is used. If there's any waste off, it has to be tracked and monitored. And we're supposed to be the educated professionals, so the average citizen out there really needs to be accountable to how easily these things can be distributed, how easily you're not watching them. Just to set them on a counter, set them in a medicine cabinet is just not acceptable nowadays. Too easy of access for people.
Absolutely. We've touched on this a couple times, and I think it's just a good message for our parents who may be watching. 90% of addictions, whether to any substance, 90% start before the age of 18. And we've talked about that because our adolescents, our young people, their brains are developing. And it's, I think, a good message, and parents need to understand when you put a substance into a young person's body, it's going to affect their brain. It's going to affect their brain development, and especially if there is a predisposition to addiction or substance use disorder, it's gonna affect them harder than most people. So that's a conversation to have with a teen, to let them know, your body and your brain is at a different place, and that's why this can have long-term effects on you. So I think that's always just we've touched on it briefly, but it's a good reminder for our parents out there. So thank you so much for joining us this afternoon. We've really covered a lot of awesome information to help prepare our communities to reduce the amount of overdoses that we see. This program was sponsored by Alabaster for Tomorrow, which is the City of Alabaster's community prevention team. We have awesome volunteers that come together every other month who plan our awareness and our outreach into the community, and we would love to have you join us at our next meeting. We also share information on our Facebook page, as well as we come out into the community to do presentations, and we hope that you continue to follow us and stay informed as to how you can prevent youth substance use.